Do you sometimes feel like people are watching you, even when no one is there? Or maybe you've heard someone call your name when the room was silent. These experiences might be more than just stress. They could be signs of a serious mental health issue. Now, what if I told you that some of these scary thoughts or visions can actually be caused by drugs or medications? That's exactly what happens in substance or medication-induced psychotic disorder. It's a condition where someone starts having hallucinations or false beliefs, like thinking the police are chasing them, when they're not, because of using certain substances like street drugs, alcohol, or even prescriptions. Imagine taking a painkiller your doctor gave you after surgery, and suddenly you start seeing spiders crawling on the walls. That's not your mind going crazy, it might be the medication affecting your brain temporarily. Sounds scary, right? But the good news is once the substance is stopped, many people get better quickly. Let's walk through this together. So, what actually causes this? It's all about brain chemistry. Your brain uses natural chemicals to help you think clearly, feel emotions, and know what's real. But drugs and some medications can mess with that balance. For example, using methamphetamine might make you feel alert at first, but after a while, you might start believing your neighbor is spying on you through the TV, even though there's no proof. That's psychosis triggered by the drug. Other common culprits include high doses of steroids, like those bodybuilders use, certain Parkinson's medications, or even too much of an antipsychotic meant to help. Alcohol withdrawal is another sneaky cause. Someone who drinks heavily for years might see bugs all over their arms when they stop suddenly. Think of your brain like a radio. The right stations, chemicals, give clear sound. But drugs are like static. They drown out the real signal. So the main cause, a substance messing with your brain's messaging system. How do you know if someone, or maybe even you, is going through this? Let's play spot the sign. Imagine your friend hasn't slept in 2 days after using cocaine. Suddenly, they whisper, "I see 2 guys in black suits following me, they work for the government." That's a delusion, a fixed false belief. Or maybe your cousin on strong painkillers keeps swatting the air saying, "Get those birds away from me," when there are no birds. That's a hallucination, seeing or hearing things that aren't there. Other signs include talking in a jumbled way, like saying the sky eats spoons today. Acting super paranoid, locking all doors 4 times. Or becoming very agitated. These symptoms start during or soon after using a substance. The key clue: if the person stops the substance, and the weird thoughts fade within days or weeks, it's likely substance-induced, and not something like schizophrenia. Would you panic if your sibling yelled about aliens? Maybe. But understanding it's a drug side effect helps you respond with care, not fear. How do doctors figure this out? First, they ask, "What have you taken? Pills, drugs, alcohol?" Be honest, no shame. They might do blood tests or check your medicine list. For example, an old man on a new Parkinson's drug starts yelling at imaginary intruders. The doctor links the timing and stops the drug, symptoms improve. That's diagnosis in action. It's not just about tests, it's detective work. The key rule: the psychosis must start during or soon after substance use or withdrawal, and not be better explained by another mental illness. Treatment step 1: safely stop the substance. In some cases, like alcohol withdrawal, this means hospital care. Step 2: doctor may give meds to calm the mind, like anti-anxiety or antipsychotic drugs, but carefully to avoid making it worse. Support matters too: a calm room, kind words, and staying close, but not crowding. Imagine helping someone wake up from a bad dream gently. Recovery is often fast if treated early. So, if you're worried about someone acting strangely after using something, don't wait, seek help. Can we stop this before it starts? Yes, the best prevention is knowing the risks. Would you jump into a river if you can't swim? No, right? Same with strong drugs. Avoid street drugs like meth or LSD, they're top triggers. If you're prescribed a strong medication like steroids or ADHD stimulants, ask your doctor, could this cause strange thoughts? Know the signs. If you or someone starts acting off, stop the drug and call a doctor. For people with addiction, rehab and support groups can save lives. Think of it like wearing a seatbelt, simple but life-saving. Also, never mix drugs and alcohol. They can team up to cause chaos in your brain. Keep medicines locked and labeled. Teach teens that party pill might give you more than a buzz, it could steal your grip on reality. Prevention isn't about fear, it's about power through knowledge. Scientists are learning more every day. Recently, researchers found that some people have genes that make them more sensitive to drug-induced psychosis, like having a weak filter in the brain. That means two people can take the same drug, but only one gets psychotic. New brain scans are helping doctors see how substances change brain activity in real time. Also, apps are being tested to help people track mood and symptoms after taking meds, like a mental health journal on your phone. Some hospitals now use quick saliva tests to check for drugs in emergency cases, so treatment starts faster. One exciting advance: doctors are developing safer versions of strong medications that treat pain or depression without the mind-altering risks. So while we can't change the past, science is building a safer future, one brain scan, one support app, one safer pill at a time.